Detroit Mercy, we want to train students to become ethical healthcare professionals that are at the top of their game, looking
The
to practice.
school, with the location where it's at, we're able to teach the students a variety of clinical skills and provide a lot of opportunities in a expanded scope of practice so that way they can serve a diverse population.
Our students are definitely offered a variety of patient demographics. We love serving the underprivileged in the Detroit area.
Students.
So utilizing simulation provides the opportunity that students get to grow at their own pace and they get to have the latest technology here right on campus to improve.
I think technology is huge in our profession, and providing our students with the latest in technology to learn with will just give them a little bit extra edge.
So our intent is to be able to give students all the tools that we have at our disposal so that they can get the highest learning experience possible. And so we believe the simulation technology helps us to accomplish those goals.
It'll promote clinical skills by allowing students to practice at their own pace. It'll give them hands-on experience. It also introduces students to different types of pathology that they might not encounter during their rotations or during clinical practice.
So they're able to have more practice time outside of the lab and outside of clinic hours. And it also provides examples of pathologies before they even see it in clinic. Seeing it in a simulation makes them a lot more confident when they see it in clinic and they're able to diagnose it and know what they're seeing.
It allows them more time to practice these skills outside of the scheduled clinic time. It also exposes them to pathology that they may not be able to see in a live setting, giving them a very thorough experience.
Training on a simulator can provide feedback to the student on what they're doing well and what they're possibly not doing so well. It can provide feedback on how to improve their skills, and it makes them more comfortable with examining the anterior segment or the front of the eye, or the posterior segment or the retina, which is at the back of the eye. So utilizing that feedback will help them possibly optimize their skills quicker.
Mastery of the slit lamp technique requires time and requires practice. And so simulation allows students to get in more time and more practice on the slit lamp. It also allows students to hone their skills when it comes to gonioscopy, anterior segment examination, and posterior segment examination as well.
Training on the BIO simulator is going to provide so much opportunity for our students to see pathology prior to seeing it in the clinic.
Training on a BIO simulator will train the student on how to angle their lens, how to position the patient, how to get further out in the periphery.
So training on the BIO simulator will teach the student how to properly hold the lens, how to properly adjust the patient. It also will help the student with looking at the retina in different positions.
It's very, very important to be able to examine the posterior structure of the eyes and make sure everything's looking healthy. Utilizing this simulation will allow a student to become more comfortable with examining this structure and knowing what lenses